Welcome back, my dear students. Today we are exploring the intriguing world of asthma, a chronic respiratory condition that affects the airways in our lungs, making it sometimes difficult to breathe. In asthma, the airways become inflamed, narrow, and some produce extra mucus, which can lead to wheezing, coughing, shortness of breath, or chest tightness. The fascinating part, the triggers like allergens, dust, pollution, or even stress can set off an asthma attack. While asthma can range from mild to severe, understanding its mechanism, how it's diagnosed, and ways to prevent and manage it can help us lead a healthy, active life. Let's dive in to see what happens inside the lungs during asthma and how we can keep it under control. What is asthma? Asthma is a long-term or chronic condition that affects your airways, the tubes that carry air in or out of your lungs. It causes your airways to get inflamed, produce extra mucus and tighten, which makes it hard to breathe. The good news is that the airflow obstruction is usually reversible either on its own or with treatment. Key signs to remember: wheezing, that's whistling sound while breathing, shortness of breath, chest tightness, coughing especially at night or early morning. Who gets it? Both children and adults, often runs in families, just like genetic tendency. Types of asthma: allergic or extrinsic asthma. What triggers it? Things like pollen, dust mites, pet dander, mold, and cockroach allergens. How it happens: allergens attach to antibodies, release chemicals like histamine, airway tightens, and mucus increases. Key features: usually starts in childhood or teens. Family history of allergies: eczema, allergic rhinitis, food allergies. Symptoms may worsen in allergic season. Prognosis often improves with age but not always. Not allergic or intrinsic asthma. What triggers it? Viral infection, cold or dry air, pollution, stress, exercise. Some medicines like aspirin can trigger non-allergic or intrinsic asthma. The key features of this type of asthma is following: often starts in adults, usually more severe and persistent. Allergy tests are negative here. The prognosis: it is harder to control since triggers are not obvious. Occupational asthma. What triggers it? Work environment exposures like allergen, flour in case of bakers, animal proteins in case of lab workers, or latex in case of healthcare. Irritants like chlorine, ammonia, or fumes. The key features include symptoms worse at work, better on holidays. Removing exposure early prevents long-term damage. Exercise induced asthma. What triggers it? Physical activity, especially in cold or dry air. Key features are: starts 5 to 15 minutes after exercise, wheezing, coughing, chest tightness during or after exercise. It is more common in people who already have asthma but can affect anyone. Prevention: warm up exercise, inhaler before activity. How asthma is diagnosed: history and physical exam, recurrent wheezing, breathlessness, cough, chest tightness, etc. Symptoms vary over time or with triggers. Family or personal history of allergies. Lung function test, spirometry test, measures how much air you can blow out in 1 second, that is FEV1. Asthma signs: FEV1 is low, it improves more than equal to 12% after inhaler. Peak flow meter, it measures peak expiratory flow, that is 20% variation during day, suggests asthma. Broncho provocation test, used if lungs seems normal but symptoms suggest asthma. It involves inhaling a mild irritant like methacholine to see if airways tighten. Allergy testing: skin prick test or blood test to identify allergens. Other test: chest X-ray to rule out other problems. Fractional exhaled nitric oxide or FeNO for inhalation. How to prevent asthma attacks? Avoid triggers. Keep your home dust free. Wash bleeding. Use filters. Avoid smoking and second hand smoke. Limit exposure to pollen, mold, pets, strong odors. Wear a mask in cold or polluted air. Control allergens. Dust proof covers for pillows and mattresses. Keep indoor humidity less than 50%. Keep pets out of bedroom if allergic. Vaccinations, annual flu shot, pneumococcal vaccine for severe asthma. Medicines, control medications, daily inhaled steroids, ICS for reduced inflammation. Long acting beta agonist or LABA only for ICS. Leukotriene blockers reduce inflammation. Biologics like anti-IgE for severe allergic asthma. Reliever medications as needed. Short-acting beta agonist or SABA. Example হচ্ছে salbutamol. Lifestyle tips: regular exercise with warm up, healthy weight, stay hydrated, breathing exercise like yoga, pranayam, etc. Patient education: learn correct inhaler technique, make an asthma action plan, monitor peak flow at home. Summary: asthma is common, manageable, and controllable. Knowing your triggers, taking medications correctly, and practicing health habits can keep your airways open and prevent attacks. I hope this class helped you to understand asthma, how it is caused by airway inflammation, the allergic and non-allergic mechanisms behind it, how it diagnosed using lung function test and allergy test, and the ways to prevent attacks through trigger avoidance, medications, and lifestyle measures. Remember, knowing your triggers, taking medications correctly, practicing healthy habits, and monitoring your breathing can help you stay safe and breathe easier. If you found this lesson helpful, please like, share, and subscribe. See you in the next class. Thank you.